the psychological and physiological benefits of listening to music, a comprehensive review. Hello, everyone, back again with Stereopedia. Don't forget to subscribe and press the bell button to keep getting the latest updates from us.
Music is a universal element of human culture that has been utilized for various purposes throughout history, from ritualistic expression to therapeutic interventions. Recent research has underscored the multifaceted benefits of music on mental, emotional, and physical well-being. This article reviews the existing literature on the psychological and physiological advantages of listening to music, examining its impact on mood regulation, stress reduction, cognitive performance, pain management, and social connectivity. The paper concludes with implications for the integration of music into daily life and therapeutic settings. Introduction. Music, a form of auditory art, has played an integral role in the human experience for millennia. Anthropological findings suggest that music predates written language, serving as a conduit for emotional expression, communication, and social bonding. In modern times, music is accessible to most individuals and is increasingly being recognized not only as a source of entertainment, but also as a tool for enhancing psychological and physiological health. This paper explores the various benefits of listening to music and its applications in personal and clinical contexts. Music and emotional regulation. One of the most documented benefits of music is its capacity to regulate emotions. Research shows that individuals often use music to elevate mood, calm anxiety, or even process sadness. Jocelyn and Sloboda, 2010. Functional magnetic resonance imaging, fMRI. Studies reveal that music activates the brain's reward system, particularly the ventral striatum and nucleus accumbens areas associated with pleasure and motivation. Salimpour et al., 2011. Furthermore, listening to music has been found to reduce the levels of cortisol, a stress hormone, leading to increased feelings of relaxation and well-being. Emotional regulation refers to the processes by which individuals influence the emotions they experience, when they experience them, and how they express them. Among the many tools available for emotional regulation, music stands out due to its immediate accessibility, cultural ubiquity, and capacity to evoke and modulate emotional states with precision. Research in effective neuroscience demonstrates that music can evoke complex emotional responses, such as joy, nostalgia, awe, and even bittersweet sadness, without the need for accompanying lyrics or visuals. Kolsch, 2010. This phenomenon is largely attributed to music's ability to influence the limbic system, particularly the amygdala and hippocampus structures involved in emotion processing and memory. In addition, the prefrontal cortex, responsible for decision-making and emotion regulation, is also activated during music listening, suggesting that music helps integrate emotional responses with higher-order cognitive functions. Blood and Zator, 2001. A study by Jocelyn et al., 2008, proposed the Breck-Vima model, which outlines 8 mechanisms through which music can induce emotions: brain stem reflexes, rhythmic entrainment, evaluative conditioning, emotional contagion, visual imagery, episodic memory, musical expectancy, and aesthetic judgment. This model explains how music can not only reflect but actively shape a listener's emotional state, whether by calming physiological arousal, evoking vivid autobiographical memories, or triggering empathetic responses. Moreover, music is frequently used as a self-regulatory strategy. In daily life, individuals report listening to music to enhance mood, reduce boredom, manage anger, or cope with grief. Saracalio and Urkala, 2007. These practices are particularly effective because they engage both cognitive and emotional systems, allowing listeners to reframe negative emotions and reorient their mental state. Experimental studies support these findings. For instance, participants exposed to preferred music in stressful situations exhibited lower levels of cortisol and reported decreased subjective feelings of anxiety compared to control groups exposed to silence or non-preferred music. Chanda and Levitin, 2013. Furthermore, in therapeutic contexts, music has been shown to reduce symptoms of depression and anxiety, particularly when individuals are encouraged to select or create music that resonates with their emotional experience. Moratis et al., 2008. In children and adolescents, music serves as an important tool for emotional development. Adolescents, in particular, are more likely to use music to navigate complex emotional landscapes, express identity, and cope with emotional upheaval. Papingzak et al., 2015. This highlights music's role not only as an emotional regulator, but also as a mediator of psychosocial development. In sum, music is a potent agent of emotional regulation, acting through both biological and psychological pathways. Its ability to modulate mood, reduce stress, and facilitate emotional expression makes it a valuable asset in both everyday life and therapeutic interventions. Music and cognitive enhancement. Music has also been associated with improvements in cognitive performance. The so-called Mozart effect, first reported by Rauscher et al., 1993, suggested that listening to classical music can temporarily enhance spatial-temporal reasoning. While subsequent studies have produced mixed results, meta-analyses suggest that background music, especially instrumental music, can enhance focus and memory in certain contexts. Schellenberg, 2005. Additionally, music therapy is increasingly used in patients with neurodegenerative diseases, such as Alzheimer's, to stimulate memory recall and improve orientation. Cognitive enhancement through music has garnered significant attention in both scientific and educational communities. Cognitive functions such as attention, memory, problem-solving, and language processing are essential for daily functioning and academic or professional performance. Listening to music has been shown to influence these cognitive domains, both directly and indirectly, through mechanisms that engage neural, emotional, and behavioral processes. 1. The Mozart effect and beyond. The concept of music enhancing cognition gained popularity with the publication of The Mozart Effect by Rauscher, Shaw, and Kai, 1993, which suggested that listening to Mozart's compositions could temporarily improve spatial-temporal reasoning. Although the initial claims were modest, they sparked widespread interest in the potential for music to boost intellectual performance. Subsequent studies and meta-analyses have shown that while the Mozart effect may not be unique to Mozart or consistently replicable, the phenomenon appears to reflect a broader principle. Listening to music, particularly complex and structured forms such as classical or Baroque music, can facilitate arousal and mood states conducive to cognitive performance. Chabry, 1999, Schellenberg, 2005. 2. Music and memory. One of the most robust cognitive domains influenced by music is memory. Music aids memory encoding and retrieval through the use of rhythm, melody, and repetition. This is evident in educational settings where songs are used to teach language, mathematics, and historical facts. Neuroimaging studies indicate that listening to or recalling music activates regions of the brain involved in memory, including the hippocampus and the dorsolateral prefrontal cortex. Janata, 2009. In clinical contexts, music is especially beneficial for patients with memory impairments. Alzheimer's and dementia patients have shown improved autobiographical memory recall and emotional responsiveness when exposed to familiar music. This phenomenon, sometimes referred to as the reminiscence bump, suggests that music acts as a powerful cue to unlock long-term memories, even when other cognitive abilities have deteriorated. Cuddy et al., 2010. 3. Music and attention, focus, and executive function. Background music can also impact concentration and attention. While results vary depending on the complexity of the task and the type of music, instrumental or low-arousal music tends to enhance focus during repetitive or creative tasks. Music with lyrics, on the other hand, may interfere with reading comprehension or language-based problem-solving due to verbal interference. Shi et al., 2012. Moreover, listening to music can modulate the brain's executive functions, which include planning, inhibition, and cognitive flexibility. Music's rhythmic properties have been shown to improve task switching and time perception, likely due to entrainment synchronization between external rhythms and internal neural oscillations. This entrainment may help regulate attention and enhance the brain's capacity to process information efficiently. Thought et al., 2009. 4. Long-term cognitive benefits of musical training. Beyond passive listening, active engagement with music, such as learning to play an instrument, has profound and long-lasting effects on brain development and cognitive performance. Musicians consistently show superior working memory, auditory discrimination, language processing, and visuospatial abilities compared to non-musicians. These differences are attributed to structural and functional changes in the brain, including increased corpus callosum thickness, enhanced connectivity in the auditory motor network, and heightened plasticity in the prefrontal cortex. Schlag et al., 2005. Studies in children reveal that music training improves performance in mathematical reasoning and verbal skills, supporting the integration of music education in school curricula as a means of enhancing overall academic performance. Gerd et al., 2008. 5 applications in neurorehabilitation and therapy. Music is increasingly being used in neurorehabilitation to support recovery from brain injury, stroke, and developmental disorders. Melodic intonation therapy, MIT, for example, uses musical elements to improve language production in patients with aphasia. Rhythmic auditory stimulation, RES, is used to improve motor coordination in individuals with Parkinson's disease or after stroke, demonstrating music's cross-modal impact on both motor and cognitive rehabilitation. Thought and Ibiru, 2010. In conclusion, listening to and engaging with music can significantly enhance cognitive functions across a broad range of domains, from memory and attention to executive function and learning. These effects are mediated by complex interactions between auditory processing, neural plasticity, and emotional regulation. As such, music offers a powerful, low-cost tool for improving cognitive health across the lifespan, with promising applications in education, aging, and clinical rehabilitation. Music as a tool for stress reduction. Listening to music has profound effects on stress and anxiety. Studies show that slow-tempo, low-pitch music with no lyrics or sudden changes can be effective in reducing physiological arousal. This includes lowering heart rate, blood pressure, and respiratory rate. Thomas et al., 2013. Music is now commonly used in preoperative and postoperative settings to help patients manage anxiety and pain, providing a non-pharmacological intervention that is both effective and accessible. Stress is a physiological and psychological response to perceived threats or demands, often characterized by increased arousal, anxiety, and the release of stress hormones such as cortisol and adrenaline. Chronic stress can lead to a range of negative health outcomes, including cardiovascular disease, weakened immunity, anxiety disorders, and depression. In this context, music emerges as a powerful, accessible, and non-invasive tool for stress reduction. 1. Physiological effects of music on stress. Listening to music has been shown to produce measurable changes in autonomic nervous system activity. These changes include reductions in heart rate, blood pressure, and respiratory rate, as well as decreased levels of cortisol, the body's primary stress hormone. Thomas et al., 2013. Music induces relaxation by activating the parasympathetic nervous system, which promotes calmness and recovery in contrast to the fight-or-flight response governed by the sympathetic nervous system. Functional neuroimaging studies support these findings. Relaxing music has been shown to decrease activity in the amygdala, a brain structure involved in the processing of fear and stress, while simultaneously increasing activity in the nucleus accumbens and prefrontal cortex regions associated with pleasure and emotional regulation. Kolsch et al., 2011. 2. Psychological and behavioral mechanisms. Music also reduces stress by influencing mood, cognition, and perception. It can distract attention from stressors, promote positive emotional states, and facilitate the processing of difficult emotions. For example, slow tempo, low pitch, and non-lyrical music is often used in therapeutic settings to induce states of calm and introspection, making it easier for individuals to manage anxiety and emotional overload. In behavioral terms, music provides a sense of familiarity, comfort, and safety. This psychological anchoring effect allows listeners to feel more grounded and less overwhelmed, especially during moments of crisis. Music can also enhance feelings of social connection and empathy, which act as buffers against stress. Linneman et al., 2015. 3. Clinical and therapeutic applications. Music is increasingly used in clinical environments to reduce stress before, during, and after medical procedures. Preoperative music listening, for instance, has been found to reduce patients' anxiety levels more effectively than pharmacological sedatives such as midazolam, without the risk of side effects. Nielsen, 2008. Similarly, Music therapy is commonly used in oncology wards, intensive care units, and palliative care settings to alleviate pain, anxiety, and emotional distress. In mental health care, music interventions are employed to help individuals with generalized anxiety disorder, post-traumatic stress disorder, PTSD, and depression manage their symptoms more effectively. Group drumming sessions, guided music listening, and songwriting exercises are examples of structured music therapy techniques that promote emotional expression and resilience in stressful contexts. Bratt and Dilio, 2014. For music and everyday stress management. Beyond clinical settings, music is widely used for daily stress management. Individuals often turn to personal playlists tailored to specific emotional needs for relaxation, motivation, or catharsis. Listening to music during commutes, exercise, or quiet time at home serves as an intentional strategy to modulate stress levels and improve overall well-being. Music apps and streaming platforms now offer curated playlists designed specifically for stress relief, meditation, and sleep support. A study by Linneman et al., 2015, demonstrated that listening to music after a stressful task led to faster physiological recovery and improved subjective well-being. Interestingly, self-selected music chosen by the listener rather than imposed was found to be more effective, suggesting that individual music preferences play a critical role in stress reduction outcomes. In sum, music functions as a powerful tool for stress reduction through both physiological and psychological mechanisms. It not only lowers the body's stress response but also supports emotional processing and resilience. With growing empirical support, music-based interventions offer an effective, low-cost, and culturally adaptable method for stress management across diverse populations and settings. Pain management and music. Music can also play a role in pain management. According to a systematic review by Bratt and Dilio, 2014, patients who listened to music before, during, or after surgery reported lower pain levels and required less medication. The analgesic effects of music are believed to arise from its ability to distract the listener, alter mood, and promote the release of endogenous opioids. Pain is a multifaceted experience involving sensory, emotional, and cognitive components. It is not only influenced by tissue damage or physical stimuli, but also by psychological states such as anxiety, fear, and mood. As such, effective pain management often requires a holistic approach that addresses both physical sensations and emotional distress. Among non-pharmacological strategies, music has gained substantial recognition as a safe, cost-effective, and non-invasive tool for pain relief in clinical and everyday settings. 1. Neurophysiological mechanisms of music-induced analgesia. Music's analgesic effects are supported by a growing body of neurophysiological evidence. Listening to music can stimulate the release of endogenous opioids, natural painkillers produced by the body which bind to opioid receptors in the brain and spinal cord to reduce pain perception. Stefano et al., 2004. Music also activates the dopaminergic reward system, including the nucleus accumbens and the ventral tegmental area, contributing to positive mood and a sense of pleasure that can counterbalance the unpleasant experience of pain. Salimpour et al., 2011. Functional MRI and PET imaging studies have revealed that music listening modulates activity in areas involved in both pain and emotional regulation, such as the anterior cingulate cortex, insula, and prefrontal cortex. This suggests that music does not simply distract from pain but alters the brain's processing of pain stimuli at both sensory and affective levels. Garzavireal et al., 2015. 2 psychological mechanisms: distraction, relaxation, and emotional engagement. Psychologically, music reduces the perception of pain through mechanisms such as distraction, relaxation, and cognitive reframing. By engaging attentional resources, music can draw focus away from nociceptive signals and reduce pain intensity. This is particularly effective with engaging and emotionally resonant music, which can fully capture the listener's attention and elicit powerful emotional responses. Relaxing music, especially slow-tempo instrumental or ambient tracks, can induce physiological calm by lowering heart rate and muscle tension, which in turn reduces pain-related anxiety. Music also encourages positive mood states, which are associated with higher pain tolerance. For example, patients undergoing painful procedures often report reduced pain and anxiety when listening to music they personally enjoy or associate with positive memories. Mitchell and McDonald, 2012. 3 clinical applications in acute and chronic pain. The therapeutic use of music in pain management has been documented in a wide range of clinical scenarios. Postoperative pain. Numerous randomized controlled trials have shown that music listening before, during, or after surgery reduces the intensity of postoperative pain and decreases the need for analgesics. One meta-analysis involving over 7,000 patients found that music interventions were associated with significantly lower pain scores and opioid consumption. Hole et al., 2015. A labor and delivery. Music has been found to alleviate labor pain and anxiety during childbirth. Women who listen to calming music during labor often report a greater sense of control, reduced perception of pain, and increased satisfaction with the birth experience. Simavli et al., 2014. Chronic pain conditions. For patients with fibromyalgia, arthritis, cancer-related pain, and migraines, music therapy can improve pain management and enhance quality of life. Music's ability to support emotional processing and reduce depressive symptoms plays a significant role in its effectiveness for chronic pain sufferers. Brad et al., 2016. Palliative and hospice care. In end-of-life care, music therapy helps reduce physical discomfort while also addressing emotional, spiritual, and existential distress. It promotes relaxation, offers a medium for emotional expression, and fosters a sense of connection in the final stages of life. Hilliard, 2003. 4 patient-centered approaches and personal music selection. The efficacy of music for pain relief is enhanced when patients have control over the type of music they listen to. Research shows that self-selected music is generally more effective than researcher-selected or generic music in reducing pain and anxiety. This supports a patient-centered approach, where personal musical preferences and cultural background are integrated into the therapeutic process. Dilio and Brad, 2009. In addition, combining music with other therapeutic modalities such as guided imagery, breathing exercises, or massage has been found to amplify its analgesic effects. Multimodal interventions capitalize on music's ability to facilitate relaxation, focus attention, and modulate affective states. In conclusion, music serves as a potent tool for pain management through a combination of neurochemical, psychological, and emotional mechanisms. It enhances the efficacy of medical treatments, reduces the need for pharmacological interventions, and empowers patients by giving them an active role in managing their own discomfort. As such, music therapy represents a promising and versatile addition to modern pain management strategies. Social and developmental benefits. Beyond individual benefits, music also facilitates social bonding. Group musical activities, such as singing in a choir or attending concerts, foster a sense of community and shared experience. In children, music education has been linked to enhanced social skills, cooperation, and even increased IQ. Hallam, 2010. Music's role in social development and cohesion is also evident in rituals, ceremonies, and cultural traditions across the globe. Music is not only a personal and emotional experience, but also a deeply social and developmental tool that shapes how individuals connect, learn, and grow across the lifespan. From early childhood through adulthood, engagement with music plays a significant role in fostering interpersonal relationships, social bonding, communication skills, and socio-emotional development. Its integrative nature makes it uniquely positioned to support both individual growth and collective cohesion. 1. Music in early childhood development. Research has consistently shown that musical activities in early childhood contribute to multiple domains of development, including language acquisition, emotional regulation, motor coordination, and social interaction. Jerry et al., 2012. Participating in musical play such as singing, clapping, or rhythm games helps young children learn to take turns, share attention, and respond to social cues. These activities also reinforce patterns, memory, and auditory discrimination, all of which are crucial for language and cognitive growth. Music education has been found to enhance phonological awareness, vocabulary, and narrative skills in preschoolers, particularly in settings where music is integrated into daily routines and storytelling. Furthermore, musical interactions with caregivers strengthen attachment bonds and foster emotional attunement, laying the foundation for secure social development. Trehub and Trainer, 1998.
To music and social bonding.
One of the most powerful social functions of music is its ability to promote group cohesion and emotional synchrony. Singing, dancing, or playing instruments in a group setting encourages a shared sense of identity and mutual understanding. This phenomenon is supported by studies showing that group music making increases levels of oxytocin, a hormone associated with trust and bonding. Keeler et al., 2015. Cultural anthropologists have long observed that music plays a central role in rituals, celebrations, and collective mourning, serving as a medium for expressing communal values and emotions. In contemporary society, music continues to serve this role in contexts such as concerts, religious services, protests, and national ceremonies. By engaging people in rhythmic and emotional alignment, music strengthens the social fabric and fosters empathy and solidarity. 3. Development of empathy and emotional intelligence. Engaging with music, especially in group contexts, supports the development of empathy and emotional intelligence. Through musical expression, individuals learn to recognize, mirror, and respond to the emotional states of others. Children who participate in joint musical activities often demonstrate higher levels of perspective-taking and pro-social behavior compared to peers who do not. Rabinowitz et al., 2013. Music also provides a safe space for processing complex emotions and experiences. In adolescent development, music becomes a critical outlet for identity formation, emotional exploration, and peer connection. Teenagers often use music to express autonomy, relate to social groups, and articulate inner conflicts that are otherwise difficult to verbalize. These expressive capacities contribute to the growth of emotional literacy and interpersonal competence. 4. Inclusive and therapeutic social environments. Music is widely used as a tool to foster inclusivity and bridge social divides. Community choirs, drumming circles, and music workshops often bring together individuals from diverse backgrounds and abilities. In therapeutic contexts, music interventions have shown promise in enhancing social functioning among individuals with autism spectrum disorder, ASD, developmental delays, and social anxiety. Structured music therapy sessions can improve joint attention, turn-taking, imitation, and communication in ways that traditional verbal therapy may not. Jarrett Seger et al., 2014. For marginalized populations, including the elderly, incarcerated individuals, and refugees, music provides a sense of belonging, purpose, and cultural expression. Participatory music programs in prisons and senior homes have been found to reduce feelings of isolation and promote intergenerational and intercultural dialogue. 5. Music and lifelong social engagement. The social benefits of music extend well into adulthood and old age. In later life, music continues to serve as a medium for social connection, memory preservation, and psychological well-being. Choir participation among older adults has been associated with improved mood, reduced loneliness, and enhanced cognitive functioning. Davidson and Faulkner, 2010. Musical engagement helps maintain a sense of identity and agency, especially in the face of age-related challenges such as retirement, bereavement, and declining health. Even passive music listening in social settings such as concerts, festivals, or informal gatherings can foster community engagement and emotional uplift. The collective experience of enjoying music with others contributes to social satisfaction and a sense of inclusion, which are key components of quality of life across the lifespan. In conclusion, music significantly contributes to social and developmental outcomes by supporting emotional growth, fostering empathy, enhancing communication skills, and strengthening community bonds. Its applications span educational, therapeutic, and cultural domains, making it a vital resource for promoting social well-being and human connection throughout life. Therapeutic and clinical applications. Music therapy is an established field that leverages the power of music to address a variety of clinical conditions. It has been used to support individuals with depression, PTSD, autism spectrum disorder, and chronic illness. Active music engagement, such as singing or drumming, has been found to be particularly effective in helping patients express emotions and build resilience. Silverman, 2011. Music therapy is a well-established field that uses music intentionally to achieve specific therapeutic outcomes in medical, psychological, and social contexts. It encompasses a range of techniques from active music making to receptive listening and is facilitated by trained professionals in clinical, rehabilitative, and community settings. The therapeutic applications of music have been rigorously studied and shown to support recovery, improve mental health, and enhance quality of life across diverse patient populations. One definition and scope of music therapy. According to the American Music Therapy Association, AMTA, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional. These goals can include improving emotional expression, reducing symptoms of mental illness, supporting physical rehabilitation, enhancing communication, or promoting spiritual well-being. There are two main approaches. Active music therapy involves clients actively participating by singing, playing instruments, composing, or improvising music. Receptive music therapy involves listening to music, often combined with guided imagery, discussion, or relaxation techniques. 2. Psychological and psychiatric interventions. Music therapy has demonstrated effectiveness in treating a wide range of mental health conditions. Depression and anxiety. Numerous studies have found that music therapy significantly reduces symptoms of depression and anxiety. Engaging with music stimulates the release of dopamine and serotonin, while also modulating cortisol levels, mechanisms associated with improved mood and reduced stress. Moratis et al., 2008. Trauma and PTSD. Music provides a nonverbal medium for expressing and processing traumatic experiences, especially in individuals who struggle with traditional talk therapy. Techniques like songwriting, drumming, and guided listening have been effective in helping patients reframe traumatic narratives, regulate emotions, and rebuild a sense of identity. Carr et al., 2012. Schizophrenia and psychosis. Structured music therapy sessions help individuals with schizophrenia improve social functioning, reduce psychotic symptoms, and increase engagement in daily activities. Meta-analyses have shown that music therapy, when added to standard care, enhances outcomes more than medication alone. Gold et al., 2009. 3. Neurorehabilitation and brain injury recovery. Music therapy plays a vital role in neurorehabilitation, particularly in patients recovering from stroke, traumatic brain injury, TBI, or neurological disorders such as Parkinson's disease and multiple sclerosis. Rhythmic auditory stimulation. RES. This technique uses rhythm and tempo to improve motor coordination and gait in stroke and Parkinson's patients. The auditory cues provided by rhythmic music entrain movement patterns and facilitate neuroplasticity. Thought et al., 2007. Cognitive rehabilitation. Music engages multiple brain networks, including those responsible for attention, memory, and executive functioning. Cognitive music therapy techniques such as musical mnemonics or structured music tasks are used to improve attention span, short-term memory, and task sequencing in patients with TBI or dementia. Speech and language recovery. Melodic intonation therapy, MIT, helps patients with aphasia, loss of speech due to brain damage, recover verbal communication by leveraging the brain's music processing regions to retrain speech pathways. 4. Pain management and palliative care. Music therapy is widely used in palliative and hospice settings to alleviate physical pain, manage emotional suffering, and provide spiritual support. Pain alleviation. As discussed in Section 5, music reduces pain perception through neurochemical and cognitive mechanisms. In therapeutic settings, live music tailored to patient preferences can be more impactful than pre-recorded music. Emotional and existential support. Music therapy offers patients facing terminal illness a way to express complex feelings, reminisce, resolve unfinished emotional business, and find peace. Interventions may include legacy projects such as songwriting or music storytelling to support dignity and closure at the end of life. Hilliard, 2003. 5. Autism spectrum disorder, ASD, and developmental disabilities. Children and adults with ASD often exhibit challenges in communication, social interaction, and sensory processing. Music therapy offers an accessible and engaging modality to support developmental goals. Social skills training. Group music therapy fosters turn-taking, eye contact, imitation, and cooperative play, all critical components of social functioning. Communication enhancement. Music-based activities encourage vocalization and symbolic communication. Singing and rhythmic chanting help children with ASD develop expressive language in a structured yet flexible environment. Sensory integration. Music therapy can be tailored to support sensory processing by gradually exposing individuals to auditory stimuli and helping them modulate responses. A Cochrane review concluded that music therapy significantly improves social interaction, verbal communication, initiating behavior, and social-emotional reciprocity in individuals with ASD. Jarrett Seger et al., 2014. 6. Substance abuse and addiction recovery. Music therapy also plays a supportive role in substance abuse treatment programs by helping individuals explore emotions, build self-awareness, and develop coping strategies. Group drumming, lyric analysis, and improvisation offer non-threatening entry points for emotional expression and community reintegration. Music therapy facilitates discussions about personal struggles, fosters peer support, and provides a positive alternative to maladaptive behaviors. 7. Integration in multidisciplinary care. Music therapy is increasingly incorporated into multidisciplinary care teams in hospitals, rehabilitation centers, schools, and mental health clinics. Collaborating with physicians, psychologists, speech therapists, and occupational therapists, music therapists contribute to holistic treatment plans that address physical, emotional, cognitive, and social dimensions of health. Hospitals such as the Cleveland Clinic and Memorial Sloan Kettering Cancer Center have integrated music therapy into their clinical services, citing improvements in patient satisfaction, symptom control, and recovery outcomes. In summary, music therapy is a dynamic and versatile modality that contributes significantly to healing and rehabilitation across a wide range of clinical contexts. It promotes physical recovery, psychological resilience, and emotional well-being, offering a person-centered, evidence-based complement to traditional medical and psychological treatments. Music is more than a source of entertainment. It is a powerful and versatile tool that positively impacts human health and well-being. From reducing stress and enhancing cognitive function to aiding in pain relief and fostering social bonds, the benefits of listening to music are both scientifically validated and widely experienced. Future research should continue to explore personalized music interventions and the neurological mechanisms underlying its therapeutic effects. Thank you for spending your time with us here at Stereopedia. We invite you to subscribe and activate the notification bell so you never miss our latest updates. Until next time, stay inspired and stay informed.